good morning to all of you. I am Dr. Naveen Kumar Devangan, Professor in the Department of Electronics and Telecommunication Engineering, Bhilai Institute of Technology, Durg. It is a great pleasure to be here today with you all and talk about the exciting world of biomedical instrumentation and sensors in the fascinating realm of echocardiogram and echocardiography. First of all, we will start with introduction of echocardiogram and echocardiography. Here we will see what is echocardiogram, what is echocardiography, along with uses of echocardiography, where we will see certain cardiac diseases that can be diagnosed by analyzing echocardiogram images which cannot be detected by the analysis of ECG signals. Then we will see different types of echocardiography. We will also talk about various imaging modes used in echocardiography, particularly M mode. We will also see types of ultrasound probe used in echocardiography and maneuvering of probe to get different perspective of the heart. Now, we are going to see what is echocardiogram and echocardiography. Echocardiography is also known as cardiac ultrasound. In echocardiography, heart is examined using ultrasound technology. Echocardiography is a form of medical imaging that makes use of Doppler ultrasound or conventional ultrasound for cardiac disease detection. The visual representation or image created by this method is known as an echocardiogram, a heart echo, or simply an echo. It is one of the most popular diagnostic imaging techniques in the field of cardiology. It can provide information about the heart's size and shape, means it can measure size of the internal chamber of the heart. It can also provide information about pumping capacity of the heart. It can provide information about the extent of any tissue damage and its location in the heart. It can provide information about evaluation of heart valves. It can provide information about the cardiac output, ejection fraction, and diastolic function, that is how well the heart relaxes, and this all can be calculated using an echocardiography to provide physicians additional estimations of heart function. The Swedish physician Ine Edler is recognized as the father of echocardiography. Now, we are going to see the applications and benefit of echocardiography. In patients with suspected cardiac diseases, echocardiography is an important tool for detecting and assessing valve motion abnormalities. By showing regional valve motion abnormalities, it is a tool that helps in the early diagnosis of myocardial infarction. Also, it is important in the treatment and follow up in patients with heart failure by assessing ejection fraction. Cardiomyopathies like hypertrophic cardiomyopathy and dilated cardiomyopathy can be detected by echocardiography. In order to stabilize whether any chest pain or accompanying symptoms are caused by heart disease, stress echocardiography may also be used. The primary benefit of echocardiography is that it is non-invasive, means it does not involve breaking the skin are entering body cavities and has no known risk or side effects. An echocardiogram can produce accurate assessments of the blood flow through the heart using Doppler echocardiography, which uses pulsed or continuous wave Doppler ultrasonography in addition to ultrasound images of cardiac structures. When assessing valve motion abnormality with suspected cardiac disease, echocardiography is an important technique. This enables assessment of both normal and abnormal blood flow through the heart. Color Doppler as well as spectral Doppler is used to visualize any abnormal communications between the left and right sides of the heart. Any leaking of blood through the walls, that is called valvular regurgitation, and estimate how well the valves open or do not open in the case of valvular stenosis. By using tissue Doppler echocardiography, the Doppler technique can also be utilized to measure tissue motion and velocity. Now, next I am going to explain types of echocardiograms. There are three primary types of echocardiograms. First is transthoracic echocardiogram, in short it is called TTE. Second one is transphageal echocardiogram, in brief it is called TEE, and third one is intracardiac echocardiogram, in brief it is called ICE. Stress testing utilizes transthoracic echo in combination with an exercise modality, for example, a treadmill, and resulting image is called stress echocardiogram. Now, I am going to explain transthoracic echocardiogram, that is TTE. Sound waves with frequencies above the audible range are known as ultrasonic waves, that is higher than 20 kilohertz. A standard echocardiogram is also known as a transthoracic echocardiogram or cardiac ultrasound, and it is utilized for a quick assessment of a patient at their bedside. This method TTE is non-invasive, highly accurate, and provides quick assessment of the overall function of the heart. With this technique, an echocardiography transducer or probe is applied to the subject's chest wall or thorax, and images are captured through the chest wall. TTE makes use of many windows to visualize the heart from different perspectives or angles. Each window has advantages and disadvantages for viewing specific structures within the heart, and typically numerous windows are utilized within the same study to fully assess the heart. Parasternal, apical, subcostal, and suprasternal windows are shown in figure in the slide 8. Parasternal long and parasternal short axis windows are taken next to the sternum. The apical 2, 3, 4 chamber windows are taken from the apex of the heart, that is from lower left side of the heart, and the subcostal window is taken from underneath the edge of the last rib. You can see these windows as shown in figure in this slide. TTE utilizes 1 M mode, 2 and 3 dimensional ultrasound. Time is implicit and not included from the different windows. This can be combined with pulse wave or continuous wave Doppler to visualize the velocity of blood flow and structure movements. Images can be enhanced with contrast that are typically some sort of microbubble suspension that reflect the ultrasound waves. Now, I am going to explain transphageal echocardiogram, we call in short TEE. A transphageal echocardiogram is another way to perform an echocardiogram. By inserting a specialized probe with an ultrasonic transducer at its tip into the patient's esophagus through the mouth, allowing image and Doppler evaluation can be performed from a location directly behind the heart. When transthoracic images are not as clear and accurate as needed for assessment, this method is used. A cardiologist, anesthesiologist, registered nurse and ultrasound technician are present while this test is carried out. To make the patient more comfortable throughout the surgery, conscious sedation and or localized numbing medication may be employed. TEE, unlike TTE, does not have discrete windows to view the heart. To change the view of the heart, the entire esophagus and stomach can be used. The probe can be advanced or removed along this dimension. The majority of probes include the ability to deflect the probe tip in one or two dimensions to enhance the perspective of the heart. Additionally, the ultrasound crystal utilized is often a two-dimensional crystal, and the ultrasonic plane can be electronically adjusted to enable an additional dimension to improve views of the heart structures. Often, movement in all of these dimensions is needed. TEE can be employed in catheter or surgical based procedures or as a stand-alone procedure. For instance, during a valve replacement procedure, the TEE can be utilized to evaluate the valve function both before and after the procedure. This permits revising the valve mid-surgery if needed to improve outcomes of the surgery. Now, I will talk about the stress echocardiography. In order to evaluate the heart's valve motion in reaction to physical stress, a stress echocardiography, also known as stress echo, uses ultrasound imaging of the heart. First, images of the heart are taken at rest to acquire a baseline of the patient's valve motion at a resting heart rate. The patient next takes another form of exercise or treadmill walking to raise heart rate to target heart rate, which is 85% of age predicted maximum heart rate, that is 220 minus patient's age, or to the target heart rate. Finally, images of the heart are taken at stress to assess valve motion at the peak heart rate. A stress echo measures the heart's valve motion but does not directly image the coronary arteries. A valve motion irregularity may be brought on by ischemia of one or more coronary arteries and may be a sign of coronary artery disease. A cardiac catheterization is the old standard procedure to immediately create an image of the coronary arteries and to assess for stenosis or occlusion. A cardiac sonographer and a licensed medical practitioner such as a cardiologist are present during the non-invasive stress echo procedure. Now, I will talk about intracardiac echocardiography. In brief, it is called ICE. A specialized form of echocardiography called intracardiac echocardiography uses catheters to put an ultrasonic probe inside the heart to observe structures there. Alternative access to the left heart would be retrograde through the aorta and across the aortic valve into the left ventricle. IC is frequently used as a part of the cardiac procedure of crossing the interarterial septum with transseptal puncture to allow catheter access from the right atrium to the left atrium. The advantage of intracardiac echocardiography over transthoracic echocardiogram is that IC is not constrained by visibility issues that may occur with transthoracic or transphageal echo. However, there are image quality restrictions because the probe's size is restricted by the catheter. IC is often inserted through the femoral vein and into the right atrium. The interarterial septum, all 4 heart chambers, all 4 valves and the pericardial area for an effusion can all be seen clearly from the right atrium. It can also be advanced across the arterial septum into the left atrium to visualize the left atrium appendage during left atrial appendage occlusion device deployment. Now, going to explain what is intravascular ultrasound. We call in short IVUS. Intravascular ultrasound is a specialized form of echocardiography that uses a catheter to insert the ultrasound probe inside blood vessels. This is commonly used to measure the size of blood vessels and to measure the internal diameter of the blood vessel. For example, this can be used in a coronary angiogram to assess the narrowing of the coronary artery. If the catheter is retraced in a controlled manner, then an internal map can be generated to see the contour of the vessel and its branches. Contrast echocardiography needs to be addressed in brief also. The addition of an ultrasound contrast medium or imaging agent to conventional ultrasonography is also known as contrast echocardiography or contrast enhanced ultrasound. The ultrasound contrast is made up of tiny microbubbles filled with a gas core and protein shell. This enables the ultrasound waves to be reflected by the microbubbles as they travel through the circulatory system, producing a highly reflecting image. Contrast enhanced ultrasonography can be helpful in a variety of situations. Like the most commonly used application is in the enhancement of left ventricle endocardial borders for assessment of global and regional systolic function. Contrast may also be used to enhance visualization of wall thickening during stress echocardiography for the assessment of left ventricle thrombus or for the assessment of other masses in the heart. In the case of coronary artery disease, contrast echocardiography has also been utilized to evaluate blood circulation across the myocardium. I will talk about 3-dimensional echocardiography in brief. By utilizing a matrix array ultrasonic probe and right processing technology, 3-dimensional echocardiogram, which is also referred to as 4-dimensional echocardiography when the image is moving, is now feasible. It enables detailed anatomical assessment of cardiac pathology, particularly valvular defects and cardiomyopathies. The ability to slice the virtual heart in infinite planes in an anatomically appropriate manner and to reconstruct three-dimensional images of anatomic structures make it unique for the understanding of the congenitally malformed heart. Real-time three-dimensional echocardiography can be used to guide the location of biotomes during right ventricular endomyocardial biopsies, placement of catheter-delivered valvular devices, and in many other intraoperative assessments. Anatomical intelligence or the use of organ modeling technology may be used in three-dimensional echocardiography technology to automatically identify anatomy based on generic models. All generic models refer to a data set of anatomical information that uniquely adapts to variability in patient anatomy to perform a specific task. This technique, which is based on feature identification and segmentation algorithms, can provide patient specific three-dimensional models of the heart as well as the brain, lungs, liver, kidneys, rib cage and vertebral column. Now coming to various imaging modes used in echocardiography. The various modes listed below essentially describe how the ultrasound crystals are used to obtain information. A mode, amplitude mode imaging. It displays the amplitude of a sample voltage signal for a single sound wave as a function of time. This mode is considered as one-dimensional and used to measure the distance between two objects by dividing the speed of sound by half of the measured time between the peaks in the A mode plot, which represents the two objects in question. Amplitude mode is not a mode used in modern echocardiography. So, A mode is not generally used in modern echocardiography. Now, coming to B mode called brightness mode imaging is the same as A mode, except that brightness is used to represent the amplitude of the sampled signal. B mode imaging is performed by sweeping the transmitted sound wave over the plane to produce a two-dimensional image. Typically, multiple sets of pulses are generated to produce sound waves for each scan line. Each set of pulses are intended for a unique focal point along the scan line. Brightness mode is often synonymous with 2D and is very commonly used in echocardiography. Third mode is M mode, we call motion mode display. It refers to scanning a single line in the object and then displaying the resulting amplitudes successively. This shows the movement of a structure such as heart. Because of its high pulse frequency up to 1000 pulses per second, this is useful in assessing rates and motion and is used extensively in cardiac and fetal cardiac imaging. Motion mode is also used in modern echocardiography. It has specific uses and has the benefit of very high temporal fidelity. For example, measuring left ventricle size at end diastole. Now, we will see echocardiograph M mode in detail. In A mode display, ultrasonic echoes produce vertical displacement of a horizontal trace on and the distance along the horizontal trace on CRT. Basically, the amount of vertical displacement is proportional to the strength of the echo, and the distance along the horizontal trace represents the time of sound travel in human tissue, thereby permitting accurate measurement of tissue depth between any two echo sources. By electronically rotating the A mode echoes 90° towards the viewer, the echoes can be presented as a bright dots of light along an imaginary horizontal baseline as shown in figure 1. The distance between the dots again represents time or tissue depth, and the intensity of the dot represents the strength of the echoes shown in figure 1. Figure 1 shows principle of time motion M mode display. Here you can see the amount of vertical displacement is proportional to the strength of the echo, and the distance along the horizontal trace represents the time of sound travel in human tissue, thereby permitting accurate measurement of tissue depth. If one of the echo source is a moving structure, then the echo dots of light from that structure will also move back and forth. If the dots are made to move with an electronic sweep from bottom to the top of the screen at a pre-selected rate of speed, the moving dots will trace out the motion pattern of the moving structure. This display is known as M mode display. If a photographic film is continuously exposed to one sweep cycle of this display, a composite picture will result, providing a waveform representation of the motion pattern of the moving structure like as shown in figure 2. Figure 2 shows various M mode display from various structures of the heart with different directions of the probe, providing echocardiographic examination of the heart. Alternately, thermal video printers are used for recording the M mode information. Figure 2 shows the echocardiographic examination of the heart and illustrates typical M mode display from various structures of the heart with different directions of the probe, providing echocardiographic examination of the heart. Figure 3 shows the block diagram of an echocardiogram which is based on the M mode. Several circuit blocks are common to the general echo measuring instrument except for the addition of a slow sweep circuit and recording arrangement. For echocardiography, the transducer is placed between the third and the fourth ribs on the outer chest wall, where there is no lung between the skin and the heart. From this probe, a low intensity ultrasonic beam is directed towards the heart area and echo signals are obtained. The probe position is manipulated to obtain echoes from areas of interest in the heart. The instrument presents time versus motion information about heart structure on slow speeds normally used in electrocardiogram recordings. When an ECG trace is superimposed on the ultrasonic display, the movement of structures detected ultrasonically can be conveniently correlated with the known events in the cardiac cycle. The echocardiogram is currently the best method for the diagnosis of mitral stenosis. Echocardiography is also often used for the study of the aortic valve, tricuspid valve and pulmonary valve. Another very important use in the detection of pericardial effusion, which is the abnormal collection of fluid between the heart and the pericardial sac. This examination can be performed quickly and easily at the bedside if necessary without apparent risk to the patient. Figure 4 shows a typical echocardiogram illustrating mitral valve motion. Figure 5 shows an abnormal echocardiogram. Image shows a mid-muscular ventricular septal defect. The trace in the lower left shows the cardiac cycle, and the red mark shows the time in the cardiac cycle when the image was captured. Colors are used to represent the velocity and the direction of the blood flow. Now coming to the type of transducer used in echocardiography. At present, phased array transducers are used almost exclusively for echocardiography. A phased array ultrasound transducer is typically 2 to 3 centimeter long, consisting of 64 to 128 elements. It is a smaller assembly than a sequential array and can be either linear or curvilinear. A sector field of view is produced by all elements firing to create a single waveform as shown in figure 9. Now we will see multi-element linear array scanners use. First one is linear sequential arrays. The sequential linear array scans a rectangular region as shown in figure 7a. The scanning lines are directed perpendicular to the face of the transducer. The beam is focused but not steered. Linear array transducers are available with 512 elements in currently available ultrasound scanners. Generally, up to 120 elements are selected at a time for the operation. As is obvious from the diagram, the field of view with a linear array arrangement is limited to the rectangular region directly in front of the transducer. Second, curvilinear arrays. As shown in figure 7b, a curvilinear array scans a wider field of view because of the convex arrangement of the array elements. Curvilinear or convex arrays operate in the same manner as the linear arrays, and therefore, even this case scan lines are directed perpendicular to the transducer face. Third type transducer, linear phased array. The arrangement of the elements is similar to the linear sequential arrays, but the scanner steers the ultrasound beam through a sector shaped region in the azimuth plane, and this is shown in figure 7. The present linear phased array systems have up to 120 elements, and all the elements are used to transmit and receive each line of data. This arrangement has the advantage that the scanned region is much wider than the footprint of the transducer, thus making them suitable for scanning through restricted acoustic windows, such as in the case of cardiac imaging, wherein the transducer has to be looked through a small window to avoid the obstructions of the ribs and lungs. Now, fourth one, two-dimensional phased array. A two-dimensional phased array has elements in both the azimuth and elevation planes. Therefore, two-dimensional arrays can focus and steer the acoustic beam in both dimensions, thereby to produce a volumetric image as shown in figure 7d. Figure 7 shows different arrangements in multi-element array scanners, linear sequential arrays, curvilinear array, linear phased array, 2D phased arrays. Figure 8 shows commercially available linear, curvilinear and phased array. Figure 9 shows linear phased array and illustrates how ultrasonic beam can be focused in any desired direction by controlling the phase of applied voltage to individual elements. Figure 10 shows conventional single transducer versus phased array consisting of 16 transducers. Now, maneuvering probe in echocardiography. When describing maneuvering of the TT probe, certain nomenclature should be reviewed. Motion of the transducer is described as such: angle is sliding the transducer tip side to side to image in parallel planes. Rotate is the twisting the transducer tip in a set position to image bisecting planes. Tilt is the rocking of the transducer tip within the same plane. The probe can be angled from the same location. Different views of adjacent structure can be interrogated. You can see in the given figure 11. The probe can also be rotated upon its axis to obtain different views of the heart. From the same acoustic window, rotation of the probe can obtain different views of the heart. You can see this in the given figure 12. Lastly, tilting the probe from its acoustic window will obtain different views of the heart. You can see this in the given figure 13. In the last, coming to windows used in echocardiography. 4 TT windows used to image the heart: parasternal, apical, subcostal and supraesternal. The table below shows the TT window, the position of the probe, the direction of the notch, the location of the probe and structures that are imagined. Figure 14 shows the anatomical display of the standard transducer. American Society of Echocardiography recommended transducer positions are echocardiographic windows showing standard transducer maneuvers conducting during the normal transthoracic examination. With this, I complete my today's lecture on echocardiogram. If you need any further information or clarification, feel free to contact me through my mail naveen.devangan@bitdurg.ac.in. In my next lecture, I will be available with another interesting topic, BIMS. Till then, goodbye. Thank you all.